Hi, everyone. Thank you so much for joining us this evening for this educational webinar to learn more about fibroids. My name is Casey Reffner, and I am the marketing coordinator here at Gynesonics, and I will be your moderator this evening. We are so lucky to have Dr. Washington with us this evening. She is an OBGYN from Hilltop Obstetrics and Gynecology in Middletown, Ohio. Dr. Washington, thank you so much for joining us and taking time out of your evening to be here.
Thank you.
So before we get started here, ladies, I just want to do a few housekeeping things. We want this to be an interactive webinar, so please, as you have questions or comments, please put those in the chat, and we will be sure to address those at the end of the presentation. All right, Dr. Washington, I will kick it over to you, and let's talk about fibroids.
Good evening, everyone. So tonight we're going to talk about a new treatment option for women with fibroids. For many, many years, there's really only been one solution, and that was hysterectomy. And now there are some new solutions in the pipeline and out, and we just wanted to share those with you. Next slide. So we're going to play a video. This talks about 7 women. They're real people with their real stories.
Most fibroids are asymptomatic or without symptoms. For the women that do have symptoms, the symptoms are heavy menstrual bleeding, low pelvic pressure. You could have problems with urination, constipation.
I first started having symptoms about 7, 8 years ago.
In my early 20s.
Probably 8+ years ago.
4 years ago.
When I first started my cycle at age 14, and they were always horrible.
And some of the stories that women have communicated to me have been otherworldly. They really modify their whole lifestyle as a result of their symptoms.
My symptoms got so bad that I actually had to change careers because I could not continue taking days off of work because I couldn't get out of bed.
My symptoms were so bad to the point I will be in the house a week straight.
It was essentially having my period all month long.
When I was taking sick days because I just couldn't get out of bed, painkillers were not helping.
I don't remember a time when fibroids didn't affect me.
My doctors told me that the best treatment would be most likely a full hysterectomy to treat this.
They offered me birth control pills to help with the bleeding.
I went to several doctors looking for an alternate opinion, and I consistently got hysterectomy being my only option.
Hysterectomy or myomectomy, I believe, is the other option she gave me.
A hysterectomy was my only option.
A hysterectomy. And then they suggested I could take some birth control pills.
Minimally invasive hysterectomy, your recovery is 3 to 4 weeks. If it's done open, it's a 6 to 8 week recovery.
I thought a better option would just be to deal with the symptoms than to have my body parts removed.
There were not any treatments for it.
The Sonata treatment is for women with symptomatic fibroids who want to preserve their uterus and avoid major surgery.
After my Sonata treatment, I saw relief. I wasn't having constant periods every single day.
It just started getting lighter and lighter.
I say about a 75% reduction from what I was used to.
I do not suffer from the pain, the cramping, or the heavy bleeding like I did prior to the Sonata treatment.
I don't have to worry about going anywhere when I'm have my period. I don't have to worry about if it's going to be an incident like before.
The procedure takes less than an hour typically. Recovery is a half hour to 45 minutes before you're discharged and ready to go home.
I no longer have to carry an extra change of clothes. I don't have to keep anything on my mattress.
You have a chance to actually have this treatment and know that your life can be so much better.
Absolutely, hands down. Investigate it, check it out. I would look at it as a first option.
I know this sounds weird, but I can wear white pants and not be nervous about it.
I would definitely tell them to try the Sonata.
The Sonata treatment is very effective. 95% of the women have a reduction in menstrual flow after 1 year, and 97% would recommend it to a friend.
Look into the Sonata process.
Just give it a chance.
It's a game changer.
I never got to wear tampons before. I can wear tampons now.
I believe it's the way to go.
All right, next slide. So what are fibroids? Fibroids are benign, non-cancerous growth of the uterus. Basically, they come from one muscle cell which overgrows. And the issue is the tissue, instead of being soft like the uterus, is hard. And so when they're large, the problem is they're large, hard growths that are in the uterus. And if they are associated with the lining, the portion that you shed each month, they can definitely increase the amount of bleeding that you have. Next slide. So not all fibroids are the same. And depending on where your fibroids are or what type of fibroids they are, depends on if you have symptoms. And not everyone has symptoms at all. So the first type is what we call submucosal fibroids. Those are fibroids that are associated with the lining of the uterus. And because they're associated with the lining, that portion which you shed each month, some people can have very heavy periods and on occasion can affect fertility because it can affect where the egg and the sperm can implant. You can also have intramural fibroids, and this is the most common. These fibroids are in the actual muscle of the uterus, the portion that contracts when you're having a baby. And you can get abnormal periods, you can get bloating, you can get frequency and urination if they're large because they're literally just pushing up against your bladder or pushing up against your rectum, or your uterus is large enough with these intramural fibroids that your uterus is no longer in the pelvis, it has risen outside of the pelvis. Last but not least are subserous fibroids, and those are fibroids that are closer to the outside of the uterus, but closer to the inside of the abdominal cavity. And so these, especially if they're large, you can get bloating and you can get discomfort and pain with them. Different symptoms that you can have because of these fibroids are just heavy bleeding. You can have long periods. So you're missing time off, or you're missing time at work. You're missing out on other things you do outside of work. You need to pack additional clothing. And of course, intimacy issues because you're bleeding, because you're in pain. Next slide. So these are just some facts about fibroids. So in the United States, nearly 70% of white women and more than 80% of Black women will have fibroids before age 80. I'm sorry, before age 50. It's estimated that somewhere between 20 to 50% of these women with fibroids will experience symptoms. Remember, not everyone with fibroids has significant symptoms. The vast majority of people will go to their grave with their fibroid. Each year, approximately 2 million women undergo some type of treatment for fibroids. That could be medication, that could be surgery, but some type of treatment. And if your mother, your sister, your aunt had fibroids, you are at increased risk for developing them. They have not yet located the gene that this is on, but we do know that there is a familial history with fibroids. Next slide. So how do you know if your symptoms are caused by fibroid? So again, most symptoms are going to be heavy bleeding, prolonged or painful periods, or due to either of these, you're missing out on life because of your periods. Generally, when you go in for your annual exam, if the fibroids are large, over about 3 to 4 centimeters, they can be palpated on pelvic exam. Otherwise, if you're having symptoms, but your uterus still feels normal, I always tell patients I can feel, but I can't see. So our number one way of seeing is ultrasound. So ultrasound is that indirect look where you can see the fibroid. On occasion, we'll do MRI or CT. Those probably aren't the best ways. Generally, for the gynecologist, ultrasound is going to show you what you need to see. Next slide. It's been noted that many women wait on average years, so 3.6 years, with 32% of people waiting up to 5 years before they even say this is a problem. So if you look, 79% of women say they don't want invasive surgery, they don't have time for this. And there is a significant amount of women who want to preserve their uterus. Even if they don't want to have children, they just do not want to have a hysterectomy or a major surgery. Next slide. So there are new treatment options that we're going to go over. So the new treatment options that you have, next slide. So there's medical or hormonal. So lots of people will talk about there are some medications out that you can take. Some people will talk about putting you on the birth control pill to see if that will regulate you. If your fibroid is mainly inside the cavity of the uterus, so inside the lining, we can do what's called a hysteroscopic myomectomy, meaning we can remove that fibroid using a vaginal approach. The problem is the majority of fibroids are not. The majority of fibroids, again, are going to be intramural or in that muscle. And so therefore, you can't use this hysteroscopic procedure to do that. Years ago, uterine artery embolization came out. So that's where they go through an artery in your groin. And instead of, just like you could go to the heart, instead of going to the heart, they go to the uterus and they use sterile beads to clot off the blood supply to either the artery going to that fibroid or the arteries going to or partially clot off the arteries going to the uterus. And by doing this, you decrease blood flow to the uterus, and that can help with bleeding. It unfortunately didn't take off the way that people thought it would, just because it is a somewhat invasive procedure. Next would be laparoscopic or open myomectomy. So that's where we're either taking out fibroids laparoscopically through the camera and the small ports, or we make an incision to do that. So that's a good procedure for someone who hasn't, who still wants their uterus because they need it for fertility or to have a baby. But in someone who is past childbearing, it's a bigger procedure than actually removing the uterus. And so generally that's not what we offer people, simply because hysterectomy, you're more likely to lose less blood than with a myomectomy. So you're more likely to have better blood control with a hysterectomy than you are with taking the actual fibroids out separately. And a hysterectomy is where we remove the uterus or the uterus and the cervix. Next slide. So this sort of talks about birth control pills and other drugs. So they can be used to manage the symptoms. They're not truly shrinking the fibroids. There are some medications that are now out on the market to help shrink fibroids, but they are temporary. They can only be used for approximately a year. And once you stop using them, if you have fibroids, those fibroids will grow again. So it's more of a stopgap to get you to surgery. So some of my patients who are teachers, they just can't, they don't have time off, so they use this as a stopgap. And it will preserve the uterus with the medication that helps shrink fibroids. It works by putting the body into menopause. So therefore you can have hot flashes, you can have night sweats. And if you use it over a significant amount of time, you can have bone loss, which could cause osteoporosis. Next slide. So the hysteroscopic myomectomy, again, that's no incisions, the uterus is preserved, but only a fibroid that is inside the cavity, and it has to be 75% or more of that fibroid that is inside the cavity can be removed. We generally perform it under general anesthesia, and about 15% of patients will need a second procedure within about 5 years because, again, fibroids can reoccur. Next slide. So uterine artery embolization, this is where the small particles are injected into the bloodstream, causing the fibroids to shrink and die. I liken it to a what they do for a cardiac cath. And so it just requires that one incision. Most people do stay overnight due to pain control. And there is something called post-embolization syndrome that is somewhat rare. But it does require 1 to 2 weeks of recovery because you are slowly killing those fibroids, and so people can have significant cramping and pain with that. Studies show again that 30% of patients require an additional treatment. And this procedure is only for heavy bleeding with fibroids. It's not for fibroids, it's not for pain or cramping. It's strictly for those people who have heavy bleeding with their fibroids. Next slide. So myomectomy, that's where we remove 1 or more fibroids. It can be done as an open procedure like a C-section incision or laparoscopically. It does preserve the uterus. You do have to have general anesthesia, and those fibroids can come back. 10 to 25% of patients may need an additional treatment after 5 years, and just that recovery at home. An open myomectomy has the same recovery as an open hysterectomy. Next slide. Last but not least is surgical removal of the uterus and generally the cervix with it. So this is the only permanent solution for fibroids. It can be done laparoscopically or what we call minimally invasively, either through the laparoscope or vaginally. or with significantly larger fibroids, we will use an abdominal incision like a C-section incision. It ends future childbearing as there's no more uterus to carry a baby in. And depending on blood supplies, it can reduce the time to menopause. So if you are genetically supposed to happen at 52, occasionally if you change the blood flow, it may happen at 48 or earlier, just because of changes in blood flow. And abdominal hysterectomy requires general anesthesia. So does laparoscopic hysterectomy. If you do it vaginally, you can do it with a spinal, but abdominal or laparoscopic require general anesthesia, and it often requires either an afternoon stay if it's laparoscopic, or an overnight stay up to a day or two for abdominal hysterectomy. And, you know, I always tell people somewhere between 3 to 6 weeks of recovery. Next slide. So we're here to talk about a new treatment, which is called Sonata. Next slide. So Sonata is a incisionless fibroid treatment. It's done vaginally. It preserves the uterus, so there's no removal of tissue. It does not require general anesthesia or an overnight stay. Next slide. So this is a video of how Sonata works. And I'm just going to talk us through it. So patient is on the table and we use radio frequency energy to treat the fibroid. So the device, that's the Sonata device, is inserted vaginally and then into the cervix. And it has an ultrasound on it. So we are seeing real time what this fibroid looks like. And then it's targeted to the fibroid. And there is a needle which penetrates the fibroid, and then it's slower than I am. Then we safety check. So we can see automatically what portion is being treated. So the red portion is being treated, and the green is the safety zone. So there's no heat at that safety zone. So we can see that there's no heat that's going to be out to the safety zone. So we just want to treat the fibroid and not anything else. And so there is that safety border, and then radio frequency energy is used. And that's determined by the machine based on how large the zone is that we are treating. And it works by shrinking the fibroids over time, reducing or possibly eliminating symptoms. So in the end, the needle is retracted back in and the whole device is removed. So none of that stays in. So 50% of women can go back to their usual within a day. And within 3 months, there is significant decrease of that heavy bleeding or decrease in symptoms. The fibroid will shrink due to this procedure. It may not go away completely, but it will shrink. And probably more important, what used to be a hard softball now turns into more like a marshmallow. And because of that, it doesn't affect you the same way. Next slide. So is Sonata safe and effective? So more than 82 women have been treated in the United States and Europe. And there are over 50 published articles about Sonata, that it is a safe and effective treatment for symptomatic fibroids. Next slide. So in the Sonata trial, 147 women were treated and followed for 3 years. So when you look at what happened, 50% returned to normal activity the next day. 95% had reduction in menstrual bleeding after at the 12-month mark. 94% were satisfied with their treatment at the 3-year mark, and 88% reported improved symptoms at 3 years. So the vast majority of people, greater than 90% of people, had excellent results with this. Next slide. So Sonata is intended to treat symptomatic fibroids. Those fibroids can be associated with heavy menstrual bleeding or cramping or pain. And I think that is the end of the talk. Are there any questions?
Yes, so we do have a few questions that came in. I do want to just talk about this slide very quickly that we have up. So there is a link in the chat if you would like to schedule a consultation with Dr. Washington or find a doctor in your area. You can visit sonatatreatment.com, and that will allow you to do that. So we do have a few questions that came in. The first one that I would love for you to answer. This woman said, is it possible for large fibroids to cause nerve pain in the hips and legs?
So the answer is absolutely yes. So I will liken it to a heart attack. So when someone has a heart attack and they say their jaw hurts and their arm hurts, it's not really that their jaw or their arm hurts. It's that the signal goes up to the brain, and when it comes down, there are nerve fibers that go to the heart, and on that same nerve train, there's fibers that go to the arm and go to the jaw. And so they, in essence, think that their arm and their heart hurt. Well, this can happen all over in the body. So the pelvis is innervated by S2, 3, and 4, sacral nerves 2, 3, and 4, and they also go into the legs. And so people who have significant cramping with their periods can also have hip or leg pain. It's honestly not your hip or your leg that hurts, but it's the signal going up normally and coming down. It gets a little mixed up. And so where you are feeling that pain are your hips or your legs.
Great information. Thank you. Let's see here. We have a couple more. So if there is no general anesthesia during Sonata, what kind of pain can a patient expect during the procedure?
So I am a physician that only does it under general anesthesia. But I would think that you could do it under spinal. So a spinal is like an epidural that someone would get when they're in labor, except there's no retention of anything in the back. It's put in the spinal space, and it works for about 2 hours. And you're going to be numb basically from the nipple down. And if you do it under spinal, you still would not have any pain. This is not a procedure that I would try in the office or that I would do with local. But you certainly could do it with a spinal if you just absolutely didn't want to have general anesthesia.
Thank you. So staying on that topic a little bit, this person asked, will I need an overnight stay in the clinic or hospital after the treatment? Can you kind of talk about, when patients are going home and that type of thing?
Yeah, so all of my patients have gone home same day, so it's outpatient. So you come in 2 hours before, the procedure takes an hour. You go to the recovery room for an hour and then go home within about 30 minutes after that. I do send people home with pain medicine, ibuprofen, and also like a narco, which is hydrocodone, or a Percocet. Many people don't need them, but just in case, everyone's pain is different. But even those who have used them only use them for a day or two.
Great, thank you. This person is asking, can you treat large fibroids with Sonata?
So you can, and how that is done is we'll treat the same fibroid multiple times, because you can see, because of that ultrasound, which portion of the fibroid that you treat. And once you treat a fibroid, it changes color on the actual screen. So what was more a blackish color now is a more whitish color, just due to how you denature those proteins. And because of that, you can treat like if you have a big 8, 9, 10 centimeter fibroid, you're not treating that fibroid once, but you're treating it in three different areas to get the entire fibroid.
Great, thank you. Are there any side effects to the treatment?
No, at least I have not had anyone with any side effects. The biggest side effect is decreasing bleeding, but that's, generally why people want to do it. This is a procedure that you can, if you desire, put a pregnancy in, later. So once your uterus is healed, you can, just like with the myomectomy, you can have a successful pregnancy with a Sonata, versus if you have a hysterectomy, you cannot have any more children. If you have a myomectomy and go too deep, you have now made it so that you must always have a C-section, whereas you don't have that issue with Sonata.
Great, thank you. Kind of going back to treating large fibroids, somebody asked, what is considered a large fibroid?
So I would say anything 6 to 8 centimeters or more. I think the largest fibroid I treated was about 10 centimeters. And it takes a little longer because you've got to treat it multiple times to get the entire fibroid. But I would say a large fibroid is 6, 7, 8 centimeters.
Great, thank you. Is the Sonata treatment covered by insurance?
It is covered by insurance. Everyone's insurance is different. Generally, it's the same workup that you would do if you were going to have a hysterectomy, except instead of that code that we would, pre-cert to your insurance, we would use a Sonata code.
Great, thank you. Let's see here. I've got a couple more. This person said, my fibroid has caused fairly significant abdominal bloating, such that many of my pants no longer fit, and it actually almost looks like I'm pregnant, although I'm not. Is it correct that it could take up to 12 months for that abdominal bloating to decrease?
So yes, so this is not a quick fix. Some people, they have it done and their next cycle is lighter. But when you're talking about bloating symptoms, symptoms of large fibroids, pressure, pain symptoms, those are not quick fix symptoms that will happen over time. And I would say 3, 6, 12 months.
Thank you. This is not a question, just a comment. This person said my largest fibroid is 9 centimeters.
So that would still be treatable. Again, we would have to treat that same fibroid multiple times to encompass the entire fibroid, but it is still treatable with Sonata.
Great. Geez, it's great. We have so many questions. Another one that came in. Is there any regular follow-up with the doctor after the procedure? In other words, are there regular ultrasounds afterwards to try to detect if the fibroid is in fact shrinking and getting smaller?
So everyone will have a post-op visit, and then generally we would see you back in 6 to 6 months or so. And at that time, we could get an ultrasound to see it, does it look like these are getting smaller or not? But then when you go to have your annual exam, especially if your uterus was large, at that point, you definitely would know, like, is your uterus smaller or is it getting bigger?
Okay, let's see here. Somebody asked, what are the prerequisites before the Sonata treatment? Like, do you need x-rays or any certain type of imaging?
So basically just an ultrasound is all you need. If you are over 35 with heavy and irregular bleeding, we would do what's called an endometrial biopsy, where we take tissue from inside the uterus to ensure that that tissue is not abnormal or cancerous. And that's just the standard of care for any woman over the age of 35. Generally, we'll also make sure your thyroid is okay, that your hemoglobin is okay, that we're not missing something else. But that's about it.
Thank you. This is more of a general question. Do fibroids grow back or can they grow back?
So fibroids absolutely can grow back. There's not, so 30% of women, if you would take them out by myomectomy, will ultimately have additional fibroids. That is a genetic thing, not that it's genetic in you. There's not a way to know whose fibroids are going to grow back and whose aren't. So it really is, are you part of that 30%?
Let's see here. Is there a fibroid that is too large for the Sonata treatment? In May of this year, this person said my fibroid was measured to be 10 centimeters. And because my symptoms are getting worse, I worry that maybe my fibroid is getting larger.
So I have only done one that's about 10 centimeters. I will say, I don't know if there's a fibroid that's too large to treat. All you could do is try and see if it works. But my 10 centimeter one was very successful. There's just not a whole lot of studies out there for very large fibroids.
Great information. Thank you. Let's see. We have time for a few more questions. This one says, how long is the time before each treatment if multiple treatments are needed?
So I have only done single treatments and I haven't done multiple treatments. But I suppose if you wanted to do multiple treatments, I would say minimum of a year, because you don't know if the first one worked until you get to that year mark.
Thank you. I have one more question here. Would fibroids grow back with a hysterectomy?
No, so no. If you remove that muscle tissue where the fibroid came from, then no.
Great, thank you.
Mhm.
Let's see here. I have just one more question. And this is another general question, but do we know what causes fibroids?
We do, I mean, what causes fibroids is one muscle cell overgrowing on itself. Now, why that happens, I can't say. Like why you have one muscle cell in the uterus that overgrows and becomes a fibroid versus you don't have that in the muscle cells of your legs, your arms, your abdominals. We don't know that. I can just tell you what a fibroid is. It's one muscle cell that has overgrown.
Great information. Thank you. Just a couple comments. So somebody said this was very helpful. Thank you so much. And then somebody else said, gosh, the curse of being a woman. That is the reason for fibroids.
Yeah.
Alrighty. If there are no other questions, that will conclude this evening's webinar. So like I said, if you would like to schedule a consultation with Dr. Washington, the link is in the chat as well as the website on the screen, sonatatreatment.com. And so with that, I would just like to thank everybody for joining us this evening, and a very special thank you to you, Dr. Washington, for taking time out of your evening to educate these women about fibroids and their treatment options that they have.
Well, thank you.
Thank you. Thanks, everyone. Have a great night.
Bye.
Bye.